Well, hello everybody. My name's Gabby. I'm your group admin. And today I just wanted to talk about what I hear most days actually from my clients is that they've been told there's basically nothing wrong. They've got IBS and they just have to live with it. And I have people sitting in my office sobbing. It's amazing they've managed to get to the office because you know what it's like. It can just be a series of driving somewhere with non-stop toilet visits. But it can be hard to accept that there's nothing we can do, it's just IBS. When you know to your core, there has to be something wrong. They may not have found anything, which is great, but it means that the test that you have had, be it an endoscopy, a colonoscopy, sigmoidoscopy, whatever tests have been run, they've shown that you don't have tumours, that you don't have anything desperately wrong with you. You don't have cancer. You don't have celiac, for example. Great news. There's nothing physically wrong that they can find. So you're given almost a clean bill of health. But it's at times like that that people can feel, well, what is the cause then? What is going on? Why is my body responding like this? And we hear these questions in the group. So Desiree and I do follow what's happening in the group. We hear your pain. There's so much going on and people just want answers. And it's great that you guys are trying to help each other because everyone's just been so supportive. We founded this group 4 years ago and more recently, there's been so much interaction from people. It's been great. And so we wanted to take the opportunity to start doing more and more live Facebooks where we can communicate, but also to help to educate. We have got so much knowledge and we'd love to share that with you. So I put together a little presentation and this is what I'm hearing every day. There's nothing wrong. It's just IBS. And in my mind, I'm thinking, I know something must be triggering what's going on for that particular person. I just realized I don't know how to get my next slide along. Just bear with me one moment. Nope. Right, hang on a minute. Okay. But the thing is, you can end up leaving your appointment and thinking, but there must be something going on because I can't keep off the toilet. So if you've got abdominal pain, constant diarrhea, you're noticing mucus in your stools, you've got severe cramping, you spend your life on the toilet, you're going hot and cold with sweats, you feel like throwing up with pain. This is not normal. It's not just IBS. And there is something that's actually triggering it. So as naturopaths, what Desiree and I do is actually do something called functional testing. Functional means that we look at the root cause of what's going on. So root causes mean that instead of just looking at all the different symptoms that somebody may be displaying, we see what is the one thing that could be triggering this series of reactions. Another thing that functional medicine does is use different systems and tools in order to discover these root causes. So lab tests is one of these, which is what I wanted to talk about. So you can leave your appointment and still feel like you're suffering gas, bloating, indigestion, pain, diarrhea, and still just none the wiser for what's going on. So we run different series of lab tests to find out, well, how is food actually being digested? Because although the symptoms can actually be quite low down in the gut, the issue may be higher up. So it could be that the stomach hasn't got the capacity to digest food appropriately. So it requires lots of different enzymes to break down food. It's actually quite difficult, and we're a walking chemistry factory. There's different acids, bile acid, pancreatic juices, different forms of digestive enzymes, and this occurs not just in the stomach but throughout the small intestine as well. So some of the lab tests look at how food's being digested. They also look at what the composition is, and that's of the stool. So it's interesting because by the time clients come to me, I say, well, has anyone actually done a stool assessment on you? I say, no. Well, how can you know what's going on if you don't know what's actually coming out of the body? So under a microscope using, it's a type of technology called PCR. It's looking at the DNA of excrement. It's seeing if there's any pathogens there. It's seeing if there's any bugs that aren't supposed to be there. Looking at the quality of the flora there. And really analyze it. Only when you know what the composition is can you see what's been happening further up the gastrointestinal tract. The other thing is functional testing looks at where that issue may be. So is it the stomach? Is it the bile? Is it the pancreatic juices? Is it the small intestine? Is it the large intestine? Or is this more to do with the mucosa, which is the lining that goes throughout the gut? And some of the tests that we look at discover all of this through something called biomarkers. Biomarkers are basically the end products of something. So that could be from the stool or from the urine. So one of the first tests we tend to look at is a stool test. And we're looking at how food is actually being digested and how it's also being absorbed in the gut. So it's looking at something called pancreatin elastase. And this is really useful because you can see how protein is being digested. Imagine if you're not fully breaking down your meat, chicken, fish, eggs. That's what gives you amino acids, and that's what helps you to build new tissues in the body, like the gut lining, new hormones so that you feel calm, and also new mood chemicals, your neurotransmitters. So these amino acids that come from protein are vital in the way that we're feeling. One of the other things that's looked at is inflammatory markers. So this is determining if there's actually inflammatory bowel disease. So you do want to know if there's the inflammatory bowel as a disease or whether it's irritable bowel syndrome, because they're actually very different and treatment is very different. So some of these inflammatory markers can show us the integrity of the gut lining and whether there's high inflammation in the body. Now, again, there's actually triggers for these things. So it's just providing information about what's happening in the body. And the other thing that the stool test looks at is the ratio with all of the gut microbiome. This is all the gut flora, the good guys that are there. And sometimes we can see that all the good guys are there, but they're perhaps in the wrong ratio. Sometimes we see that complete species are actually absent. They're missing, they've gone. And I have to say, once they've gone, they've pretty much gone. You can't really re-establish these things. It's quite tricky to do so without doing actual fecal transplants. So this gut microbiome is what controls the level of our immunity as well. This gut microbiome needs to be quite specific in its ratios and in its abundance for us to have good immunity and good response as well to any pathogens. So looking at the stool can show us if there's a parasite, a bacteria, overgrowth of yeasts, because these all produce different symptoms. So if you ever wake up in the morning and you just feel exhausted when you wake up, you might feel headachy, like you just want to go back to sleep. It may be that's when the abdominal cramping starts, or as soon as you open your eyes, you notice the bloating start. Then this would probably be the first place to look at. Really analyze the stool and find out what is happening throughout that entire gastrointestinal tract. But another lab test that is really useful actually is a urine test. Again, it's looking at biomarkers. So this is things that have been used up or spent in the body, and we're measuring the outcome in the urine. And this in itself is actually a really thorough test because it's looking at bacterial markers. So is there bacteria there within the gut? It's looking at fungal markers. And it sounds strange looking at this via the urine when the issue's with the bowel. But again, this is to do with the end products of things that have gone through the body already. So when there's say, yeast markers, looking at these different biomarkers can actually show if that yeast is internal or whether actually it's being triggered by molds. So there could be something in your environment that is creating this huge yeast response in the body. And of course, people will get bloating with that and they'll just feel dreadful. In fact, I did this for a client recently who came to me convinced that the issue was with heavy metals. So I ran a lab test on heavy metals and it wasn't that. So I did this particular urine test and the yeast markers for mold were absolutely huge. And when I questioned about his environment, he said, no, I don't live in a moldy house. But he did go home and he did explore and he sent me photos of these spores just everywhere. I don't know if he'd never noticed it before or what, but it seems like his landlord had just papered over all the molds that were there. This was causing huge symptoms in him. He was incredibly ill. But I wouldn't have known to ask him about this if it hadn't have been for this particular test. So it's useful to check the yeast, fungi, bacteria, and again, malabsorption, how well is something being broken down by the body. This particular test is also really useful for those who just have no get up and go anymore. So utterly exhausted. It looks at the neurotransmitters, which are the mood chemicals. So we can see how the body is processing, whether there's excitatory neurotransmitters, so people just feel really anxious all the time. We see this such a lot in the group. There's really high anxiety with the IBS, or whether there's more what's the opposite of excitatory? I'm having a mind blank. But something has been depressed, and that is how they're feeling in themselves. They're feeling low. They've got no motivation, no lust for life. Another really useful test, especially in IBS sufferers. In fact, I think 70 to 80% of people that suffer from IBS actually suffer with overgrowth of bacteria in the small intestine. So this can be determined by a breath test. Really simple to do. You basically down either lactulose or I've forgotten the other. We use glucose or lactulose. And over the next 6 hours, the breath is collected. And that breath can be excreting products of bacteria. And the beneficial bacteria is supposed to be living in the large intestine, but actually the wrong types of bacteria can migrate through the ileocecal valve into the small intestine, where they actually start to ferment. And this is why people who are on the low FODMAPs diet can get quite a lot of benefit from it. So FODMAPs means that they're choosing foods which don't have this fermentable action. Therefore, there's nothing feeding that bacteria that's present in the small intestine. But it's also quite intense to do this FODMAP diet. So it's preferable to know if you're actually dealing with SIBO or not. The other tests that we look at are the blood tests for immunoglobulin G, this is called. Often it's just a simple finger prick, to be honest, but it's quite a useful way of looking at whether you're having a sensitivity or an intolerance reaction to a food. So this is different to an allergy. An allergy is really quite serious and it's also instant, but this can be delayed reactions. So they can take up to 72 hours to appear. So you may never make that connection with what you've eaten 3 days ago and what's happening in the gut. You know, you could be having severe upper tenderness in the abdomen, and then huge bloating, literally looking like you're 9 months pregnant. And that could have been something really innocuous that you ate. The obvious things tend to be things like gluten and dairy, but it's not always the case. I've seen lettuce come up for somebody. I've seen banana and avocado. So some random things may show, but once you can identify what you're reacting to and take that out of the diet, it makes a huge difference. If the stool test also then indicates that you just haven't been digesting key food groups in the first place, and you put in that support, the gastrointestinal tract has what it needs to function effectively. The last test that we tend to use is a stool test for Helicobacter pylori. There's actually different ways of testing this. Breath is another way we could do this, but Helicobacter is a bacteria, and when it's present, actually, it can cause such bad troubles with indigestion and ulcers and terrible acid. Generally, here in the UK, your GP can test for this. Whether they will or not is different. But if you've got lots of heartburn, indigestion, constant nausea and acid, I would be pushing for that particular test. At least it needs ruling out. If there's Helicobacter, doctors generally give antibiotics. Desiree and I are naturopaths, so we don't use antibiotics. We use herbs. Herbs are incredibly powerful. They have so many different uses, and they also prevent the body getting used to them. So there's a problem at the moment with antibiotic use, one of those being small intestinal bacterial overgrowth. But when you look at all the symptoms that you may be experiencing, really it's like all the leaves on a tree. So lots and lots of things going on that if you, as a practitioner, if you're not careful, it's quite overwhelming when people present with so many symptoms, and gastrointestinal things are just one of those. Obviously, if your gut isn't happy, the rest of your body starts to experience things like joint aches and pains, headaches, skin rashes, mood changes. There can be anxiety, depression, or actual anger, and also sleep disturbances as well. But all of these symptoms, there's actually only usually one root cause, and using the lab test helps you to determine what that is. So there's many expressions by the body. These are what I would call body whispers. These are things that your body's been trying to tell you. It's so interesting. As a naturopath, we really observe the person. You know, we could be either one-to-one, or we could be via Skype. But we say, like, stick out your tongue. I want to see what's going on with your tongue. I want to have a look at your nails. We're looking at the colour of the person. Because all these different symptoms, they're actually showing us that the body is whispering something, it's trying to tell us something. But actually, there's only one root cause to people's symptoms. So depending on what those symptoms are, does help to guide us as to what would be appropriate lab testing. Because lab charges can go up and up and up and up if you have lots of different tests. A skilled practitioner helps you determine which is the appropriate test for you. So here's a case study of a gentleman. He, 32 years old, symptoms being abdominal bloating, loose frequent stools. You know what it's like, 10, 15 times a day. Although he's in his suit, generally he does his work from his toilet. Very low energy, rated at 4 out of 10. Actually, that's not that bad. Generally, when people come to me, they're a 0 or a 1 out of 10 and just can't get going. But what was important to him was the fact that his skin was breaking out. So in the times he wasn't on the toilet, he's actually a presenter. So being on television and skin is really important. He has to look his best, and he was getting rashes. And the other thing was he was noticing dandruff as well. So this is actually the stool test that was done, and it was showing that there's low stomach acid. So if there's low stomach acid, you can't break down your proteins effectively. So if protein isn't digested, that's when you can get symptoms of dandruff, although dandruff can also be yeasts. But the other thing is that protein is required for regeneration in the body. So his stomach acid being low and he's not breaking things down meant he wasn't regenerating as well as he could do. So his immunity was actually a bit low. This also shows high fecal fat, not digesting fat. So any meal that contained any fat was literally going straight through him, and this is where the diarrhea was coming in. We actually did a second test as well, and this was because I was suspecting small intestinal bacterial overgrowth. So this particular slide I've put because it shows what happens in terms of timing. So there's two markers that are looked at, which are hydrogen and methane, and these are measured via the breath. And after consuming the lactulose solution, we can see at increments at what point hydrogen and methane started to rise. So we know that round about 100 to 120 minutes is when that's reaching towards that ileocecal valve. And that's where the bacteria from the large intestine can migrate into the small intestine. So we can see between 60 minutes and up to 100 minutes, there's suddenly this massive hike in hydrogen. And we see that continues right through with some other peaks there leading through to the large intestine. So this is a confirmation of small intestinal bacterial overgrowth. Another way of looking at it is actually like this, where you can see the patient's results in red there, increased hydrogen showing high, increased methane showing high, and it shows that bacterial overgrowth is suspected. But what we actually did was support that digestion of food through helping break it down. There's lots of tips that we do for that. It's not just all about taking supplements. We stimulated the bile flow. The bile is so important. When people have their gallbladder removed, it's very unfortunate. That's the organ that is supposed to help break fats down. However, we can still work around that. It's not a major issue. So we stimulated the bile flow, got the bile ducts really working effectively. We eradicated the small intestinal bacterial overgrowth. And as you can see in that lower chart there, the gases analysed are now showing that pretty much within normal ranges. And it says bacterial overgrowth is not suspected anymore. So this was over a period of months. I actually didn't repeat the stool test, just the SIBO test, just due to expenses really. But we got the result that we were after. We also go off the patient's symptoms. We balance his fat-soluble vitamins. So if somebody has high fecal fat and they're not breaking down their fats, they become deficient in the fat solubles vitamin A, D, E, and K. And actually what they do is they help the integrity of the gut lining. Vitamin D is such an important marker to measure, and actually that would be included generally in the blood test options. I've talked about the blood test in terms of ruling out IgG, but I do actually look at the fat-soluble vitamins as well because they promote healing. So once he's breaking down his fecal fats better, we know that he's able to get those nutrients through food. Obviously, vitamin D comes from sunlight on the skin. So if this is something that you want to look at to find out what your root causes are, then I would suggest that we look at specific lab tests. It's hard to know what somebody actually needs unless you chat in detail. So basically, we do a quick discovery call to find out if it's right for you in the first place. But on a one-to-one session, throughout the course of that case history, finding out about your childhood experiences, your birth, when this first started, what was happening around the time that your IBS symptoms started, starts to build a picture, and that starts to help us know where we look in terms of the lab tests. And so from that, we can then implement healing strategies. So these are things that we've tried and tested and know that they work really well. We also look at specific protocols. So this is if we've determined that there is, say, SIBO, we do use quite specific protocols to help with that because I know it works, but also customized support because everybody's different and everybody may have reached this point for different reasons. It could be that the IBS only really triggers in stressful situations, for example. So then we'd be looking at how we best support the nervous system. So it's actually a very customized approach. So hopefully you know a little bit more about the lab tests. Let me know if you've got any questions. But probably the best way is to go to your ibssolution.com/apply, and then we can have a chat. So lovely speaking with you. Thanks, everyone. And I will see you at our next broadcast, which will hopefully be tomorrow. All the best.